Test, test, test. One. Yeah. Okay. I got it. I see it. All right. Hello, everyone. Welcome back to Unidos Unplugged, the podcast where community culture and wellness take the spotlight. Thank you so much for being with us today. My name is David Villarreal. I am the outreach specialist for Unidos contra la Diabetes. I will go ahead and pass it over to our guests. Go ahead.
Hi, I'm Dr. Lubeth Pérez. I serve as an assistant professor in population health and biostatistics at UTRGV School of Medicine, and I'm also the director of our community health partnership programs, which oversees the AHEC clinics that we're going to be talking about today.
Awesome.
And my name is George Rodriguez. I am the manager for our community health partnership programs with UT Health, and we will be discussing our AHEC clinics.
Great.
Hello, my name is Evangelina Valdez. I'm a family nurse practitioner, and I work primarily in the AHEC in La Victoria and Stark County Clinic.
Awesome. Well, thank you so much for taking the time and being with us today. And on that note, I guess we can touch on a little bit about what is the AHEC program and who does it serve?
Yeah, so our AHEC program, Area Health Education Center, we have three centers across the Rio Grande Valley. We have one in Stark County, one in we have one in Stark County, one in Hidalgo County, and one in Hidalgo County.
Great.
Cameron
County.
Great. No, yeah.
Sorry, it sounds like there's a car passing by.
Yeah.
And I'm wondering what that was. Okay,
Yeah,
so our AHEC clinics are area health education centers. We have three sites, one in Stark County, one in Hidalgo County, and one in Cameron County. And these are primary care clinics that serve our community members. So again, if somebody's not feeling well and they feel like they need to go see the doctor,
Okay.
they can come to our clinics.
Now, fill me in a little bit. How out there, how popular, how much do people really know about these AHEC clinics, in y'all's opinion?
I feel like a good amount of people know about them, but we could use more.
More exposure.
Yeah.
Outreach.
We
Yeah.
need. They're strategically placed in rural areas, so we really rely on like word of mouth and kind of like I saw this. I saw the nurse practitioner
Yeah.
and she was really good, so hey, you should go too. It's a
Okay.
lot of like
Word
la
of mouth.
comadre le dicen la
Yeah,
comadre.
of course, absolutely.
So-
as a lot of things are here in
Yes,
RGV,
yes,
right?
yes.
Does it function as a standard like appointment? Does it operate as a normal clinic, just like any other clinic would?
Yeah, basically.
It does, yeah. So we do go by appointment. We are subject to reliability a lot. So Eva is out at our La Victoria clinic, and she's there Monday through Friday, 8 to 5. She's booked with patients, but she has room for walk-ins as they come in. So it's basically, like I said, it's subject to availability. So we have our Bob Clark clinic out in Cameron County,
Okay,
and that
great.
one we're running 2 days out of the week.
Great.
With we're doing 1 day podiatric medicine and 1 day family medicine, so that one is more subject to appointments.
Great.
Yeah.
And services, is it again just like a standard clinic? What types of services are offered at these AHEC centers?
Dr. Perez, you want to
Sure. So we have primary care services throughout our clinics. So anybody that's 18 and older is welcome to come into our clinics. We do have some specialty care as well, such as the podiatric medicine and our internal medicine residents. But yes, they function as regular clinics, and our nurse practitioner is with us who can maybe share a little bit more of her role or, what she's doing when she's seeing patients.
So for the most part, if we, for example, have a patient that's coming in for a first-time visit, and they've never been with they're not established anywhere, and they want to do a checkup, what we typically recommend is an annual wellness examination.
Right.
Recommended that the patient comes in fasting, because we also offer laboratory services for them. So we would do, an annual, we also for women, annual wellness exams specifically towards women's health, which would include also doing PAPs, Pap smears. So we offer those services, annual wellness exams. Typically, if we start off with a patient that's coming in, getting a checkup, they do their routine labs. What we do is follow up with them in a week. If there's any type of abnormality that is noticed,
Right.
like let's say they never knew they had diabetes, then that's where we would do a continuation of care, right?
Right.
So we also offer those services. It's not like, hey, this is what you have, we're gonna refer you out somewhere. We would also provide the services for diabetes management, hypertension, cholesterol, thyroid issues, anything like
Right.
that can be managed in the clinic as well.
Yeah, and that's kind of what I was wondering, which I believe you already touched on and answered, is hey, there's a lot of people, again, they don't get screened, they don't even go to the doctor. That is what you would suggest as far as like, hey, someone's stepping in, they haven't been to the
Yes.
doctor in maybe a year. The annual wellness checkup is
Like
what?
an annual wellness,
yeah.
come fasting, we'll do labs. The labs will, first I say, okay, patients are good historians. We'll establish them in the clinic, obtain as much information as possible regarding their medical history. If they don't have any, that's okay. But we'll start that workup. That way if there's anything abnormal that we need to discuss, we discuss it in that next appointment, and just continue the management of whatever was found in the labs or
Right.
even in the vital signs, right? A lot of patients don't know that they have high blood pressure, and if it's something that's noticed on that first appointment, we'll do a continuation of care for that as well.
Right. That kind of segues into another question or topic that I kind of had in mind is I was having just a presentation in the community, and I heard of I guess a brief testimonial from someone, and they told me that they had diabetes, undiagnosed, right, type 2, and they were like, yeah, my A1C was, I believe, at a 11 point something, very high, very elevated A1C. They were on that spectrum for so long that they just got used to like
Having their
feeling that
levels
way.
that elevated, yes.
So when they start reverting back to normal, now they don't feel good. Now it's like the
Right.
opposite, and it's like, man, how many people are just out there, living that way? Which again, it touches on the question that I did want to ask from your experience or from what you see. Why is diabetes so common in the RGV?
Well, I think it's as simple as genetic factors and also our foods, what we like to eat. It's in our diet.
Right.
All those heavy starchy foods, they're very common
The
in our
tortillas.
in our cuisine. So you do see a lot of that.
Right.
I have, for the most part, I encounter patients who are very well aligned towards their specific what a plate looks like for them.
Right.
They're gonna have their protein, their rice, beans, and then they add that tortilla. you
Yeah.
know. So what I like to tell patients regarding that, is I don't think it's realistic for us to discuss changing that in the sense of you're gonna start now eating, chicken and broccoli. That's not something that they really
Can sustain.
right?
that
So
will
I want to build just for them to be more conscious of what they're eating on a daily basis and how they can make it in a healthier version. And then also I like to promote a lot the portion control.
Yes.
Right? It's okay if you have a little bit of rice, just don't do one scoop,
Right.
one full spoonful, just
Right.
reduce that portion. And even those little small changes where they're reducing their portions and even replacing to healthier versions, we'll see a difference there as well.
Right.
And it's more realistic to sustain that and build that habit, more
Absolutely.
long term.
Because they're still finding some enjoyment in the foods that
Exactly.
they're used to.
So I understand that. Why is it so common in the valley? Well, I think it's because our food is so good, but
There you go.
we can make it healthier. We can switch out things to make it healthier, and that's
Right.
where we like to educate patients on that.
Since I have you, Dr. Perez, here, and you, George, as well here, do you guys want to give some insight as to what y'all's thoughts are on why it's so high, the rates?
Yeah, so a lot of the things that were already mentioned. To add to that is a lot of times so exercise, that's one thing. We don't have a good infrastructure and built environment. It's not, if we're going to walk around the neighborhood, we're just walking around in a circle. There are places in different parts of the country and world where you're actually walking to get to places like the store or, and so here they're really, it's difficult to exercise just by doing your normal routine. Another thing is also, we have a lot of people who are reliant on the jobs that they have. And so getting a day off to maybe go check, there's this idea that, well, everybody has diabetes. I'm going to have diabetes too. And that we're complacent and that it's just okay. And so then we don't check up or we don't, and, our culture is such also that, if I show up to a party and I don't eat the food that the host made, oh, that's a big deal.
Yeah.
No te gustó mi comida, you didn't like my food, or why, you should eat some of this. There's a lot of reasons. I think a lot of reasons why we are known to have such high rates of diabetes in the Valley.
Touching a little bit on that right before I go to you, Mr. George. I remember I had a story again. I'm always out in the community, so I always get little testimonials from people that they went to a party, a carne asada, a cookout, right? And that he was drinking, like right now, how we have waters. He was drinking a water. Everybody had their Coca-Cola. And they were asking him, are you okay?
No.
Like, hey, you're okay? Are everything good? Why are you drinking water? Why aren't you? And it's kind of just that, like, I don't want to call it a stigma, but it's just
ingrained.
It's ingrained, and it's the culture that we're a part of. What about you, Mr. George? Anything to add to that?
Well, yeah, I feel like it kind of goes on what they were both talking about already.
Yeah.
So we're a community-based, I guess, culture.
Yes.
So if I go to the doctor and they're like, okay, Eva tells me like, hey, control your portions, I'm going to go to the carne asada, and they'll be like, why are you eating so little? Yeah. Or like, oh, no te gustó la comida? So
yes.
it's just like you're like, not forced, but it's just like you're pressured to finish your plate.
Exactly.
And then like, oh, you finished it? You want another tortilla? Like, here you go.
We don't even use the forks. It's just tortillas.
Yes.
Con el arroz and with everything is just tortilla.
I feel like it's, so teaching, community outreach goes a long way. So if my mom goes in and they tell her portion control, the rest of us didn't hear it. So we were like, okay, well, we're still going to continue with our portions. So I feel like talking to the community, talking to the entire family, like, hey, this is what I was told at the clinic.
Yes.
Like, let's do it as a family to try to improve the health.
Yeah.
And I feel
so
like
I think,
goes a long way.
Yes, and that's a very good point, because a lot of times there's this idea that, oh, I have to eat healthy, but now I've got to make 2 meals. I've got to make my meal and then the meal for my family. Remembering that we should all be eating healthy, so we shouldn't have to be making multiple meals. And how can we get that message out to, within our families and the community, so that we can all start eating healthy together?
Absolutely. And I believe you touched on this, Ms. Eva. You said something about genetic predisposition.
Mm-hmm.
I get this a lot as well, in the sense of like, oh, well, it's kind of like people are already kind of like accepting, like, oh, I know I'm going to have it. My mom, dad, whatever has it. But I think what people sometimes are just, they misunderstand it, is the fact that, again, they think it's almost like
There's
guaranteed.
nothing they can do about
It is not guaranteed. Out of all, again, correct me if I'm wrong, but out of all the diseases and all the bad stuff that's out there nowadays, diabetes is literally one of the only things that can be completely prevented with just simple lifestyle habit changes and changes to your nutrition. Correct?
I agree. Yes.
And I'm like, well, but people just are not aware. They don't know, and they're just like, pues, I'm gonna have it. It's they're already accepting their fate in a sense, right? The other thing I noticed too is how you were touching on it, Dr. Perez, is, well, now I have to do 2 meals, and now that whole thing where it just ends up in a way I would say becoming maybe like a burden. I was doing a presentation for some physicians at South Texas Health Systems, and they touched on the fact that, hey, this should be like, we need to be all in. We need to be all in. It can't be like, oh, well, so-and-so eats like this. This needs to be all in. The entire family needs to be involved for this whole movement, for this change to work, because it needs to be just a shift. That's how bad rates, and that's how bad things are right now with diabetes in the valley, and obviously that's what we're trying to combat here. And
Yeah. Well, and talking about
educate.
being all in, we teach our children habits because, how many children in the Rio Grande Valley do you know or do you see, that are drinking sodas before they're drinking anything else, right? I mean, at such really young ages. And that is, coming from parents and coming from a place where I think people are trying to do good and trying to be very loving. And, I'm going to give them I'm going to give them the soda they're doing. Why would I not give them soda? Or, personally, when I have like a get together at my house, I always tell people, well, there's only water at my house. If you want something different, you can bring
Okay.
it. And so, sometimes, at first I remember my parents being like, but what are you what are you gonna offer people? And I'm like, well, water. Like, it's okay to offer water. But thinking about our children and how the habits that they have, they're gonna grow up. And the issue that we're seeing is more and more young people are
Yes.
starting to have that prediabetes and diabetes, and it's because of a lifelong habit that was started at such a young age. So what can we do to break those habits? And the other thing is the way we use comfort food, right? So you had a hard day or oh, well, let's eat ice cream. Like, so then
That one gets me, yeah.
and it wires our brain to think, anytime I'm having a hard time, okay, well, cake, ice cream.
Yep.
Let me indulge.
Let me wind down
me
and
indulge.
just, eat my feelings out. Yeah. That is a huge thing. And I really appreciate that you touched on that point, because I feel like it's something that we are quick to maybe even gloss over sometimes, where a lot of the times our reward for something is that we just turn to food. So
Right.
even the valley is big and huge and rich in culture. Maybe not monetarily. We aren't known for, making a lot of money, but that's the way we show our affection or that we care, and we food.
Yeah.
Even when people pass away, it's food. It's this and
food.
that. It's always like a comfort for us. But I think it is glossed over, the fact that we use it as such, almost like a crutch. Like, oh man, today I've done it. Oh man, today I was so
Same.
stressed. We finished at an event and it was crazy, and it was, up and down all day, and you finish and you're like, oh man, let's go eat something
Like
good.
house.
Yeah, that's
It's
great.
ingrained in the culture.
Yeah, that's a
The
great
comfort.
point. Not only the AHEC doesn't only offer diabetes screenings. Can you tell us a little bit about the other screenings that are offered at the AHEC centers?
Well, hypertension management as well. How I mentioned, if on that first visit, it's noted, that the vital signs look a little wacky, especially the blood pressure that looks elevated. We definitely help patients track that at home. Okay.
Okay.
So we would provide a blood sugar log, and at times, if they don't have the machine, a blood pressure monitor as well for them to take home. And I always tell patients, hey, it was a little bit elevated. Could be that you're nervous, but I'm not going to bet it's that. So we give them the blood pressure log, the blood pressure monitor, if they don't have one. And I ask them to bring it back in a week or two, and with the blood pressure log filled up with their blood pressures from at home.
Great.
Okay. And then if something is noticed to be abnormal, then we definitely address it more in depth. We add a medication or, do what we need to do in regards to that. We offer also services like, for example, I don't know about the contraception management as well. If we have a woman, that's coming in and wants to seek contraception management, that they don't want a family or, they don't want to get pregnant right now, we offer that as well. We offer labs, like general labs, cholesterol management as well. Anything else that I'm missing, Dr. Perez?
Well, no, you did a really great job, and I want to emphasize that our clinics are there for the community, run by really big-hearted people. And so, as she was mentioning, that there are blood pressure monitors and logs that are passed out to our established patients, we have staff within the clinic that'll make sure that people understand how to use their device. So in English and Spanish, fully bilingual within our clinics, we get that information to the person, and our staff are really good at knowing how to use that equipment, and they will say, if this person is Spanish speaking, I'm going to make sure that the monitor is in Spanish so that way they can understand it better. They go through what numbers to write down on the log, and because we've seen it before where if we don't also provide that piece of education, we can't take for granted that somebody knows how to use it. I know how to use a blood pressure machine. I may not know how to use that one.
Right.
So I may have a fundamental way of I don't even know how to turn it on because maybe this one, the button, So we're very thorough. We make sure that the patient understands, that they model it back for us, that they show us how to use it, that we show them what numbers we need, because a lot of times people they'll fixate on one or the other number, and then we don't have a clear picture. So what we're wanting to get is a clear picture for our providers, and we have a really good team of people who are able to help with that. And we understand that sometimes people, the machine might run out of batteries, or, the batteries went bad. We have those things available. So for our established patients that are coming into our AHECs, we want to make sure that we set them up for success. So we think of all of the things that are going to go with their blood pressure monitor, with their glucose meter. What things do they need? It's not just the meter, but now they need strips, and now they need alcohol, prep pad, all of the things that they're going to need so that they can go to their home and really engage in using the tools, so that we can see their trends and help them manage their care.
Yeah, so I guess we strive, like what Dr. Perez was talking about, we strive to make our patients feel comfortable. Because even at that, it's just, I'm going to the doctor's, I don't want to go.
Yeah.
Or they gave me this blood pressure monitor, but they didn't explain how to do it, so I'm just not going to do it. I don't want to call, and I don't want to. So we strive to make our patients feel comfortable. Like, hey, I ran out of Lancets. Let me just show up to the clinic, and they can talk to anybody that's there.
Yes.
Like, I've been walking through the lobby, and they're like, hey, I'm here to pick up my Lancets. Oh, yeah, let me get them for you. So it's just kind of having that camaraderie type community care, just to, our patients really need the help. So
absolutely,
yeah,
that is huge. We definitely hear a lot of just lack of I don't want to say lack of care, but just lack of focus on. No, but not everybody. I didn't know how to use a blood pressure monitor. I think it's huge that you guys are taking that initiative and that extra step to actually worry about, hey, this is how to properly use it, and this is more than anything. As much as we emphasize prevention, management is just as important. And from the looks of it, not just because you guys are here doing our show, from the looks of it, it seems like you guys are really taking that extra step and really caring for your patients. That way, afterwards, after the 1 hour, 2 hour visit, they are equipped for success. When they're on their own. And I feel like that leaves a huge, lasting impact. So I really like that you guys are taking that initiative. Again, as much as, we wouldn't want it to even get to that point, the truth is that even if somebody is dealing with a chronic disease, the management side is huge for them. And if they can have someone that they can turn to confidently and lead them in the right direction, then I think that bodes well, and it goes a really long way.
Well, of course, and we're really trying to, when you establish care somewhere, it is really important that you feel connected to those individuals, that you feel welcomed. You don't want to be bouncing from provider to provider to provider, right? And that could also be a barrier when people don't know where to go or don't have, but I want people to know that they should feel comfortable coming to us, because we are public health professionals, we are nurse practitioners, medical assistants, community health workers, the patient service representatives. We are working together to wholeheartedly help somebody that's in front of us. You're not just a number to us. You're a person with a story that we are trying to figure out, okay, how can we best help you moving forward, and what kind of an impact can we have, so that later if they have a question, they're not hesitating coming back to the clinic to ask, I didn't use this because, when we had a situation recently where the person didn't know even how to turn on the machine, for whatever reason, they had something at home. They had one. Yes, I have a blood pressure monitor at home, but I don't know how to turn on the machine. Okay, well, bring the machine that you have, whichever one that you have, bring it over and we'll look at it. And so we do, and we look at it and we'll try and figure it out. And if not, here, let's just give you the one that we have. So again, I think establishing that care and then having somebody, we're not nagging you, but we are,
Right.
we'll call, but hey, it's time for your appointment again, or are you able to come? And if not, okay, well, what are your barriers and how may we be able to help you overcome some of those barriers so that you can get care?
I feel like also with what you're mentioning, Dr. Perez, I feel like this also, you know, uh, it helps you guys a lot with retention as well, I would assume. As far as like, the having the patients return and having them just continuously be, I guess, monitored and seen through you guys. I think that's great. Um, I've heard it. I've heard everything under the sun regarding this next question that I had. I want you all's input. Um, some people are just, I'm not gonna go to the doctor. I'm gonna avoid it like the plague. I'm just not going to go. I'm assuming you guys hear a lot of like once somebody does go, and let's say they are already dealing with something, whether it's a chronic illness or maybe even, God forbid, something more serious. What do you guys hear of like, hey, like how come you never came? How come? We know that there's like the usual like, hey, well, the cost and stuff like that. But maybe you guys have heard other stories or other people's perspectives on why they're just like, you know what, I'm not gonna go.
Sometimes I feel like the one of the main reasons is just, I think, the culture. Like they're busy taking care of everybody else.
Mm. That they forget to take care of themselves.
Yes, I get that a lot. When I'm seeing somebody for the first time, you haven't ever been to the doctor and you're 35.
Wow.
And it's sometimes, I think also the cost that they might be hesitant about. Cost, taking care of the family, everybody
Yeah.
else but them. And that can be, that we have a young woman, taking care of her kids, taking care of the family, the household. And then also for men, that sometimes they'll say, well, we've been just out working and I haven't had the time
Yeah.
to check myself and I feel good and I go to work and I'm good. And I think those for me are the main three reasons: the cost, busy
Sometimes
taking care of
fear,
everybody else.
sometimes, well, I just would rather not know what I might have. But I urge everybody listening right now to think, when was the last time you've gone to see a medical provider? Has it been more than a year?
Mm-hmm.
Because you should come in and come visit one of our AHEC centers. We often don't go until something is hurting or something looks odd. And we have many cases where somebody is coming in and there's clearly something wrong. Your foot, maybe it got punctured. That's something that people, when you have diabetes and you're having some of that neuropathy or you're having some issues with feeling,
Yeah.
you might step on something and not realize it. And then, so we teach people to look at their feet, maybe using a mirror. But by the time they come in and they say like, oh, well, it just started. And that's been there for a while and you haven't noticed it or so it's prevention efforts are very important.
Right.
So those things like cost goes down the more we go to the doctor. I know that sounds counterintuitive, but the more that we go, if they can catch something early on and start providing us with information and, then that there goes all of the medication that I might have to take, or,
Yeah.
so all of that prevention is really important. And we can also provide ways to just monitor your body. Like I said, those things with checking your feet, checking for sensation in your limbs, making sure that you our feelings. Sometimes people think, oh, well, I always feel bad when I just thought everybody felt like that. So you
Right.
don't know what you don't know until, you go out and we're not trying to just find things wrong with people. We are there to help the community. Um, but you'd be surprised, how
Yeah.
much we can help, especially early on.
Right. And I think that plays a huge role in the aspect of like people are just used to not feeling well.
Yeah.
And it's again, go ahead, George, go ahead.
And I feel like education goes into it a lot.
Yes.
So if a patient comes in and, oh, your diabetes is high, your blood pressure is high, we're giving you all these medications and go on your way. But then, like you were saying earlier, it's just kind of like, well, I've felt like this forever. So then when I'm actually medicating it, then it's going to make me
Yes.
feel off. So then
Yes.
the patient's like, well, I'm going to stop taking the medication because it made me feel some type of way.
Yes.
So I think that's where we come in. Eva comes in. It's just like, hey, I'm giving you this medication. This specific one is for this specific a reason, and it might make you feel this way. It's temporary or whatever it is that Eva says.
I think that's a big one for me is letting patients know. Let's say how you mentioned there's a patient with their A1C at 11.
Mm-hmm.
Their body has been used to that.
Yes.
Their sugar levels are extremely high, elevated. They're used to that. So I always like to tell patients, look, we're going to start you on this. It's going to be a process. We're not going to fix you on that first visit. But you're going to start seeing those levels drop. At first, you're going to feel not the best,
Right.
but it will get better. Sometimes, yes, it has happened, where that extra information is not provided to the patient and they're like, hey, I'm feeling worse. And that, I think it's crucial
Right.
to give them that extra information. Your sugar levels were at a, your body was used to this. We're dropping it down slowly,
Mm-hmm.
but you're still going to feel this certain way. You're not going to feel good. You're going to feel tired. Mostly like that fatigue.
Let me ask you this, Ms. Eva. I'll share a personal family story that happened. Recently, a family member of mine, he was diagnosed type 2 diabetic, and they gave him the metformin, right? And he, thankfully, nothing major. I think he said he was experiencing a little bit of bloating. I don't know if that's a common thing. He just said que in Spanish, he's like, me siento empanzado. Okay, I don't know if that's common or not. I would assume so. That's not the point. The point is that we have like a family group chat, and he sends a picture of his big old plate from the steakhouse, Longhorn Steakhouse, and then it's like ribs and mac and cheese and mashed potato. It looked delicious. I'm not gonna lie, and I was like, what's going on here? Like, didn't you just say you were like you got diagnosed as, because he was pre for a long time, and now I'm like, you're diagnosed diabetic now. And the exact response was, está bien, ya me tomé la pastilla.
Yep.
Yeah.
What? So I'm like, so then that's not how it works at all.
No.
If you're not putting it, like, how is,
No, you need to put the effort as well.
Right.
Change those habits.
where does that, 'cause again, it wasn't, obviously he didn't visit you guys. If not, he probably would have gotten the proper care he needed. Is that something that you guys have heard from maybe patients that like end up coming to you?
Maybe
like,
a
oh,
lack
it's-
of that extra information or that extra education
Yes.
where you take that extra step to tell them, hey, we're going to prescribe this, but you also need, we need to also focus on dietary modifications and how Dr. Perez mentioned, also exercise. You need to change those habits. We cannot just have you relying on a medication and then you keep your dietary choices the same.
Exactly.
Something needs to change.
I genuinely feel, and I didn't get as far as to asking him that. I genuinely feel like whatever physician saw him was just like, okay, well, here you go. And it's like, that's not the solution. Like, was he even provided any sort of education or anything like that to accompany? The medication is supposed to be a tool, right?
Yeah, but I think that goes back to culture. And once you're out in the community, because in the Rio Grande Valley, so many people have diabetes that people are talking to each other, because that's very common. Oh, I'm going to go to a party tonight. I'm going to have my insulin ready. I'm going to, have my medicine ready. And you just, it's common and you hear it. So we need to get that information out that that's
Right.
not the way to go, because then the next thing you know, you're upping and upping and upping that medication that not only increases cost, but it increases what it might be doing within your body and all of those things that happen. So it is common. I've heard that a lot in different just with patients, with doing this work for so long, with personal, right? Just how can we get away from those things? How can we get away from the easy way out? Oh, great. Now I have the medication. So now I can really eat what I want.
Right.
And so those little choices, Longhorn Steakhouse, and swap something out. Just we still have the majority of what we want, and then swap out a side for a salad or something, or the sugary beverages don't have to,
Yes, I make a huge emphasis on that. Because here, if you tell someone like, hey, pues, no more Whataburger or no more, tacos on the weekends or barbacoa, they'll lose their minds. They're like, what do you mean? This, it's like you're just kind of like, you're putting a dagger right through their heart, and when you're telling them that. But if you tell them like, hey, if you are gonna go to Whataburger and you get your usual meal, why don't you swap out the 32-ounce Coke or Dr. Pepper that you're probably gonna have that's providing no nutritional value to your meal, with a water. And then they're like, oh, well, I can still have the burger and the fries. I'm like, if that's what it takes to kind of get you on the right path, okay. But that's why we do make a huge emphasis on the sugary beverages and all that, because it is something that somebody can implement, I guess, fairly easily into their routine and see huge positive changes. On that note, I know we're winding down a little bit. On that note, do you guys have any like little tips, or maybe you, Eva, that you've kind of like, hey, this is something that we really like to, I don't want to say even promote or push, but just kind of like let people know. Like, I know, I hear a lot too, like, oh, well, nos juntamos con las comadres and we'll go walk. Like, instead of just, I'm like, if you guys are gonna chismear, pues at least, go walk. Or stuff like that, like stuff that, but stuff that you guys personally like implement into your day-to-days that help you.
I think for me, I try to focus a lot on the diet. When I'm educating the patients, I'll give them little examples, like if we like enchiladas.
Okay.
Who doesn't? Okay, let's switch out the 80-20 meat to a leaner ground beef, or turkey, the turkey ground meat version as well.
Ground turkey,
The tortilla, one tip I like to give patients, it's don't go hungry to the grocery store. Don't go hungry. So vete bien llenita, like that you just ate. Because if you do, all the choices you get are gonna be based on how you're feeling.
Right.
Then. So I tell them, go, make a commitment to a couple, minutes, just browse around the aisle of the example tortillas, right? Look around, turn around, look at the nutritional value, the calories, the carbs, choose what you feel is, less, the best. And then also, what other tips? I tell them, okay, like enchiladas, cook it a little bit, do a healthier version. The shredded cheese, does it have to be, the whole cheese, or can it be just sprinkle a little bit, the low fat one, or the 2%?
Right.
Just switch it out. What other ones? I think the enchiladas, the chicken, try to remove the skin, go for a leaner type of version of meats. Like for the elder men, I like to tell them, I kind of know what they sometimes like. And I know typically they'll go for the steaks. So I like to tell them, okay, well, if you're going to go eat a steak, does it have to be a ribeye? Or maybe you can switch it out for a leaner meat, like the sirloin. What other? I think more that I focus more like on the foods,
Great.
and yes, that's a good one too. Go out. What I like to say in regards to exercise, salte y distraite.
Yes.
Go and get fresh air.
Yes.
And they say, okay, well, the fresh air, go walk, and I also like to use it in that type of like in a mental health type of thing.
Yeah.
No nada más te quedes en la casa. Ve y distraite, sal. Go out for a walk,
Right.
and they're doing exercise, and then they're also,
Clearing your
their
mind.
Getting out of your
mind.
house.
Yeah.
Yeah. And then adding to what Eva says, I feel like physical activity goes a long way.
Right.
So our clinics are embedded in the communities. So, for example, at our Brownsville location, Bob Clark, it's at the community center, and there's a park right across the street.
Mm-hmm.
So then they also offer Zumba. They offer all these physical exercises for our patients, not just our patients, but for the public.
Mm-hmm.
So encouraging our patients to go out and look at these resources, and also it's you're talking to your comadres. Like you're out of the house, you're communicating, getting your mind off of whatever it is,
Right.
your diabetes diagnosis. I don't know, just kind of And then in San Carlos as well, we have our endowment center. It's about 5 minutes away from the
Oh,
clinic.
yes.
Yeah.
That's really nice.
We have
So-
a little park too next.
Yes.
There you
La
go.
Victoria
Yeah,
little
La
park.
Victoria. So
That's
all of our
nice.
clinics are close to somewhere where our patients can get their physical
Right.
activity in.
Right.
So
What about you, Dr. Perez? Any little hacks or tips that you implement in your day to day, or that you would want to share with somebody?
Well, in my day to day, so earlier today I was at one of our other sites, our cancer and surgery center, and I parked as far away as I possibly could. And so that just made it to where I, just get those extra steps in. I know that I didn't go walk or exercise this morning, so let's do that. That also allows that fresh air. And,
Right.
sometimes we get really frustrated because we're at the store and we're trying to find the best parking spot ever, and then somebody left something there and I can't park. Just park a little bit further away.
Yeah.
That walk is helpful for us.
Right.
We know that we want to get some sustained walking, so maybe just those are little things that you could do
Yes.
that you are trying to get healthier. So little things that I do in my day to day, and I do try and think about being intentional about going outside and appreciating nature for a little bit of time. We're in a cold front right now, so walking out and cold front and all the quotes ever. But anyway, we're in a fresh front, and
Yes.
so just walking out, listening to the birds, listening to it sets something up for the rest of your day. And
Right.
so for a lot of our patients, so do something for you.
Yeah.
Whatever that thing is, do something for you.
Yeah. It's funny right now that you mentioned the cold front, because it's a thing I hear a lot is está bien caliente. And then like we actually get a little cold front, and it is a little bit gloomy, but the weather's super nice, and like, está muy frío.
Está
It's
muy
like,
frío.
it has to be perfect.
Right.
Perfect weather,
right.
2 weeks out of the year?
Yeah. So those are all great. And I don't want to say that this is like an end all be all, but what I've also noticed in my personal experience is let's be honest. Nos gusta comer y nos gusta comer bien. What I notice a lot is there's even like a whole like snacking culture, or like I see it on TikTok.
Those little boxes, the snackle or whatever.
I see it on TikTok a lot with I forget there's an actual name for it, and there's a bunch of content creators that they cater to.
Yep.
I know we're going off a little bit on a tangent here in this conversation, but I find it really interesting, and all they do is just like they review snacks, and there's so many snacks, whether it's like snacks that are culturally relevant to us, or just releasing every day. So tan in Walmart, H-E-B, there's all these things like, I found this new whatever at, So I see them, but more of like what the heck is going on? But what I have noticed that I like to implement is I see a big difference when, again, because we all like to eat, but when it's like when you're just sitting down and having an actual meal. Home cooked actual meal, not followed by like snacking, because I don't know about you guys, but if even the plainest Lay's potato chips. I can sit down with a bag of Lay's potato chips, y si me das una soda or whatever, unhealthy soft drink. Are we really feeling full from
It's
that?
all about being intentional.
Right.
I personally feel so. A lot of times I'll eat while I'm working.
Yeah.
I
Okay.
feel like I didn't eat anything and I'm hungry again. It's my brain is doing something. I know that the nutrition went in. If I can sit for just 10, 15 minutes and eat my food and be intentional about my food, then I don't have that. So I don't know. So I try and be very intentional. So we say the same things when eating dinner, talk to each other. Talk to each other, put away the devices, and be intentional about the food that you're eating.
Right.
And so another thing that I do, I try and stay away from snacks. I don't snack because all of a sudden, those snacks turn into something really unhealthy and it's building that habit.
Yes.
So you go have dinner and you're really not hungry, but it's time for dinner. So, I'm going to eat this plate of food that I made so it's just where can we evaluate and make some healthy changes little by little, not, all at once.
Exactly. And again, a lot of the times, it's just a lot of the stuff that we are consuming that, yes, in the moment it's good and whatnot. It's just providing no real nutritional value to us, in that sense.
It's habit.
There's really no satiety that comes from it. So that's something that I like to tell. Just that was a great point. Being intentional with the food that you are eating, and I heard this great quote, and it said, "Eat to live, don't live to eat." And I feel like if we can have that little bit of a cultural shift and kind of I feel like that's what the RGV needs. We need that shift of
that mindset of
yes,
we need to eat.
All
we
of
know
us
that we have to eat. We can't go without eating.
Yes.
But what food is it? What are we fueling our bodies with? And sometimes depending on the analogy you want to use to reach the different people, but if you buy a brand new car and you're getting premium gasoline for it, or you're being careful the way you're driving it, you're not just going over all the bumps, it's the same. Our bodies have to last us our entire lifetime. So we need to treat our bodies well. And it's not something that we should really question. We should try and be very intentional about how can I treat my body well. My body is my machine that is getting me through the day.
Yeah.
So I need to eat healthy and I need to exercise. And whatever you're at, whatever stage healthy looks like to you right now, whatever exercise routine you have right now, look at it, analyze it, see if there's an opportunity to improve, even just a little bit. And by the time you know it, you get those habits. I know we've talked about this before, but I used to drink soda back in the day. And I used to drink a lot of soda, and it was a habit that I got from working in the hospitals at a young age and seeing you can have sodas for breakfast. I didn't know that was possible. And then I would drink and then I would drink a lot of sodas. And as I'm, working in healthcare and public health and all of this, I'm teaching people not to do. Okay, I need to do that too. And it took a while. It was not from one day to the next. And I was drinking a lot of soda. So I just want people to know it's not oh, well, she's able to stay off of it because she only had one soda a week or something. No, I was having multiple sodas each day.
Yeah. And
I slowly reduced that, started buying the smaller cans of soda. And then I got to, I did that for several weeks and then got to the point where I said, well, I'm only going to drink soda if I'm out. If I'm out at a restaurant. Well, guess what I did? McDonald's was having the dollar sodas back in the day. And so I would drive by 2 or 3 times a day I'm not drinking it at home. It's only when I'm out. And then, again, over time, it's just that's time and energy that I'm and money that I'm spending going out to get these sodas. And little by little, and I've gone without sodas for a long time. Maybe 12 years, 15 years, something like that I haven't drank sodas. And I'm fine. Nothing's happened to me.
You're a lot healthier because of it. That's great. The thing that I've noticed from your story, Dr. Perez, is how many people get to that point. How many people the week passes and they're like, oh, I did great. Then the weekend comes around, and it's
Yes.
Well, it
You
happened
have
to me
start
too.
small.
It happened to me too.
And not a lot of people can, like, I commend you for it. Not a lot of people can get back on that train even after they fail and stick to it to really see those, like, you know what, I'm good. I feel
think
better from it.
some of the tips that I like to tell patients is you don't have to finish the portions that you're given. Don't be forced that if you go to McDonald's and you order a meal, do you really have to finish the entire fries? Just leave half of them there and that's fine. You don't have to eat it. With the sodas, I know that there's a lot of patients, who, I mean, that's their everything,
Yes.
So realistically, what I like to tell them is, okay, share it with your wife. Share half, y no todos los días, not every day, just de vez en cuando, but you don't have to finish the entire can, or get a mini version.
Yeah.
And if you do get a mini version, share half, but slowly start making those changes where you reduce or you become more conscious about your choices. You don't have to finish your combo meal. You don't have to. Same with the Cokes. You don't have to. I know you mentioned about like the influencers, going out and promoting the snacks, this and that. Okay. If you're really inclined towards going, because we're human and we like, all the fads that are trending, and I want to try, it look delicious and the crunch, and take somebody with you, and you don't have to go and buy 2 portions. Buy 1 portion and share it.
Yeah, de probadita. como dicen
Just
por
Find
try
a
it. Just
different
to try
influencer.
it. Just try it. Si es nada más para el antojo y para probar, just try it, but take somebody with you, and you don't have to finish the whole thing.
Yeah.
And then adding to what Eva's saying, I feel like it's, in order to be more sustainable, it's better if we try to tackle it instead of one individual at a time, it's one household at a time.
Yes.
So
Perfect.
it's just if we all make the changes, for example, in my household, my significant other loves snacking. So it's just kind of like, okay, let's scale back together.
Yes.
And then we'll have our dinner and then, So adding to that, it's our culture. So
Yes.
We strive to like, oh, well, you're in it with me too, and then let's do this,
Yeah.
and we'll be able to sustain
A
it.
buddy system. That's a really, and I attribute a lot of my healthy eating habits that I have changed over the years to that, right? To having somebody that's in it together.
Right.
And so it's hard to do things alone. So find somebody and find what together that change can be. Maybe we're not ready to change the soda aspect right now, but we are ready to change the tortilla aspect,
Yes.
or whatever it is. What is that small change that we can make? Because we can also quickly influence somebody else. We can quickly influence somebody else in a positive way or in a not so positive way. So we have to, by having a partner, somebody that you can say, hey, but we said we weren't going to eat the whole thing of ice cream all day,
Accountability, somebody
Right.
to hold you
Right.
accountable.
That's great. As we shift back a little bit here to the AHEC, before we close out here, just really quick, if someone does want to make an appointment or receive services, how can they get started? Do they need health insurance? What are those processes or steps that they need to take?
So our AHECs are grant funded, so
Great.
it's something that we haven't really touched based on today, but the cost. Our cost is little to no cost to the patients, especially when they come in for their first assessment, their wellness visit. It'll get covered at 100%. We'll do all the labs, we'll do a workup, and then put them on a plan.
Awesome.
Yeah.
Yeah, so anybody is welcome into our AHECs, whether or not you have insurance, and the $10 copay. So if somebody is wanting to make an appointment, they can call our number, and we will provide that for you.
Yes, so our phone number to call any of the clinics is 956-296-1711, and they will connect you to the appropriate clinic, just like, hey, I heard about you guys, I want to set up an appointment, and we'll set you up.
Great. Before I close us out here, is there any, and this was great, by the way, you guys did awesome, and the way that everything was explained, I'm sure the listeners are going to find so much information and helpful information more than anything from it. Is there anything else you guys want to share before we close out here? Again, you mentioned where people can find you and call to make an appointment. Are you guys also on social media? So anything like that you guys have going on right now that you guys want to plug and promote, by all means.
Yeah, so we are trying to vamp up our social media.
Yeah.
So right now we have a Facebook. It is AHEC Scholars. We're looking to expand our community health partnership program as a brand. So more to come on that. We'll be sharing it with.
Okay, great. Well, on that note, we just want to thank you so much for joining us today on this episode of Unidos Unplugged. We hope you enjoyed it and then you found it useful. And we really hope to see you on the next one. Thank you so much, everyone.
Thank you.
Thank you.
Thank you.